Welcome to Health and Wellness. Così Santé, I'm Dr. Emilio, MD, pharmacist, medical director, and a guide to healthier you. Today, stick on to the rest of the video and discover the missing pearls to easy weight loss. Let's dive in.
Want to improve? Today we want to talk about a weight loss plan that actually works. Let's dive in. Many people try to lose weight but struggle to keep it off. Diets come and go, but results often don't last. Obesity, type 2 diabetes, hypertension, and the likes. The problem is not a lack of effort. It is a lack of the right strategy. Today, we will discuss a simple, realistic, and sustainable weight loss plan that actually works. I've been doing this for the last 20 plus years, so I know something about weight loss. First, you must start with the right mindset. Weight loss is not just physical, it is also mental. You need to avoid quick fix thinking. You must focus on long-term lifestyle change. You need to set realistic goals, perhaps 1 to 2 pounds per week. Look at it this way. If you could lose 1 pound per week, that means 52 weeks, 52 pounds in a year. Look at it this way. If you can lose 1 pound per week, that means in a year time, you will have lost 52 pounds. Can you imagine? You lose 2 pounds per week. That's about 104 pounds in a year. So you can immediately see you can have great results, but you must be patient. The key idea, you must be consistent, because consistency is more powerful than perfection. Perfection is not needed in this. You need also to build a balanced plan. What I call a balanced plan is preferable, a balanced plate. Instead of extreme dieting, you must focus on balanced nutrition. Your plate should include, look at it this way, very important. Your plate should include, half of your plate should be vegetables, which are full with fiber and vitamins. 1/4 of your plate should be protein. That may be perhaps chicken, fish, eggs, beans. And 1/4 of your plate should be about healthy carbohydrates, which are brown rice, quinoa, or sweet potatoes. You must consume healthy fats in your diet. So I'd say some things like at least half of your plate should be of vegetables, because they have fiber and vitamins. 1/4 of your plate should be protein, such as chicken, fish, eggs, beans, lentils. Another 1/4 of your plate should be healthy carbohydrates, such as brown rice, or quinoa, or sweet potato. You must have healthy fat in your diet, such as virgin olive oil, nuts, avocado. So the rule is you must stay away from processed food. Now, what do I mean by processed foods? Anything that you cannot identify, anything that contains more than one ingredient, it is a processed food, which means stay away from those things. You must also avoid sugary drinks. I know sodas are cheap, but water is better, or even tea without the sugar. You must stay away from refined carbohydrates, such as white bread and the like. Because by doing these things, you can help to stabilize your blood sugar, which in terms also will help to reduce your fat storage. That's important. You must also use what's called controlled portion. It is not just calories. In fact, I don't advise anyone to count calories, but you must have an idea of how much you are consuming. Even healthy food can cause weight gain if eaten in excess. So the tips are: eat slowly, stop when you feel 80% full, and avoid late night snacking or eating. In fact, if you can eat if you can avoid, in fact, if you can avoid eating after 7 p.m., that is splendid. If you can do it, I highly recommend that. Because by having what's called controlled portion, you also help to regulate the total caloric intake naturally. You must also move your body. What do I mean by that? You must move your body daily. And it doesn't mean you have to do something extreme. Why? Because exercise is essential for fat loss and overall health. But the best approach is like walking 30 to 45 minutes daily, if you can. During lunch hour, at work, go for a walk. Strength training, lift small weight, that will help you. And also simple home exercise you can do, stretching, yoga, and others. These will benefit you in the long term because why? All these things help to burn calories, they help you to build muscle mass, and they will boost your metabolism. Because a lot of time people cannot lose weight because the metabolism is slow. Especially as women approach menopause, or for men, andropause. Movement is one of the most powerful tools for weight loss. So keep moving. That's splendid. And in fact, keep on moving. You need to fix your sleep. What do I mean by that? You need to sleep at least 7 to 8 hours. Because sleep plays a major role in weight control. A lot of people do not realize that. It's hard to lose weight if you don't sleep adequately. So therefore, sleep, it's important. Try to sleep 7 to 8 hours every night if you can. Because why? Poor sleep can increase your hunger hormones. Poor sleep will reduce energy. Poor sleep also will slow your metabolism. So you need to aim, as I stated earlier, between 7 to 8 hours of quality sleep per night. Good sleep improves fat burning and appetite control. You need to manage stress in your life. I know people have a lot of stress. I know that. But you need to do the best you can. And any small thing is better than nothing. Just like when I tell my patients, go for a walk for 5 minutes. If you cannot make 30 minutes, 45 minutes, go for 5. So, same thing. Walking help in stress relief. And also distress. In order to manage. Manage your stress. Chronic stress increases cortisol. When your cortisol level is elevated, it promotes fat storage, especially around your abdomen. Reducing stress, you can use different modalities, whatever works best for you. Some people practice prayers, meditation, deep breathing, spending time outdoors, meaningful conversation, having friends around, talk. All these things can help you to reduce stress. Because a calm mind supports a healthy body. Your body must remain hydrated. Water is often overlooked. As I stated earlier, please stay away from the sodas. I know they are very cheap, but your body doesn't need them. Water is better. Drinking water throughout the day or teas will help you quite a lot. Sometimes thirst is mistaken for hunger. Hydration supports metabolism and digestion. One more thing I want to put emphasis on it. Get enough sunshine or vitamin D. Because there is a number of patients who have difficulty to lose weight, and the main culprit is low or insufficiency or deficiency of vitamin D, please see your physician to check your vitamin D level. It goes a long way. That's very important. But the most important in all this, your weight loss must be sustainable over time. The best plan is one that you can maintain, not the one that works for your friend. You have your own way of doing things, and that's good. Your body is different. Find a plan that works for you. And then remember, half a pound per week weight loss means you will have lost 26 pounds in a year. That's wonderful. So therefore, avoid extreme diet, what we call the yo-yo diet. Avoid starvation. There are people who assume to lose weight they must stop eating. Please don't. Because when you stop eating completely, your metabolism slows down as well, which translates difficulty in losing weight. You should avoid unrealistic goals. Please do something that you can maintain consistently. And by the way, if you try, it doesn't work, keep trying until you have tried at least 7 times, 7 times 7. But keep on trying. Never give up. Okay? Never give up. Therefore, you should focus on small daily improvements, consistency over time. You need to build habits, not restriction. You build good habits, not restriction. So my message for you today, the truth about weight loss is simple. There is no magic solution. There is no magic bullet. But there is a proven formula that I have used for my patient over the years. And I found it to be very useful and helpful. Because I have found people sometimes who have difficulty to conceive, and the culprit may have been the weight gain. So by trying to lose weight, you may be surprised. Conception may be better for you, may be easier. Okay? Try that. And as I stated, check your vitamin D level. Things that will make a difference in your life. So you need to eat better. You need to move more. You need to sleep well. You need to manage your stress. And you need to stay consistent. As I stated, if you cannot walk 30 minutes a day or 45 minutes a day, go walk for 5 minutes. So I'm asking you, go for a walk for at least 5 minutes daily. That cannot hurt you. Okay? Just do 5 minutes if you cannot make it to 30 or 45 minutes. Because small changes done daily can lead to powerful, lasting results. This is Dr. Milliardaire of Health and Wellness. Cause Santé. If you found this information helpful, share it with someone who is trying to improve their health. And don't forget to subscribe for more health insight. And please check the likes. Remember that better days are ahead. May God be with you.